Hi, my name is Nancy, and I'm going to be conducting a musculoskeletal video, and I'm going to ask my sister Lucy if it's okay if I examine her and have it videotaped and have it uploaded to YouTube. Is that okay with you?
Yes, it is.
Okay, so now I'm going to adjust the camera to accommodate for the testing that I'm going to start now, the exam. Okay, so I'm going to start with the hands. I'm looking at both hands. I'm just looking right now. I'm looking for nodules, any kind of deformities, any deviation of the joints, symmetry, things like that. Okay, so that's my inspection. Now I'm going to palpate the joints. This is the distal interphalangeal joint, the proximal and the metacarpal joints. So I'm going to palpate both hands for joint tenderness. And if you would just let me know if you feel any pain. Okay, now the other hand. Okay, so that was my palpation. Now I'm going to conduct some range of motion tests on the hands. So I'm going to ask the patient to, with her fingers, to flex and then extend upward, and to do both hands. So extend down and then flex up. That's for the fingers. And then for the thumb, the same thing. Okay. All right. Now I'm going to look at the, okay, we're also going to do the abduction and adduction of the hands. So this is adduction, abduction, asking the patient to do both hands. Okay, good. All right. Now I'm going to check the wrist. Same thing as I did for the hands. I'm looking for anything that's any masses or abnormalities of the wrists. Again, on the hands, I'm to look on this side as well as the dorsal side. Okay, so now the wrists look fine. Now I'm going to palpate the wrists for any joint or tenderness. Okay, now I'm going to check the range of motion of the wrists. So I'm going to ask the patient to flex downward for the wrists. You can see both. And now flex back. That one's a little bit harder. Okay, now I'm going to ask you to kind of turn your wrist around in circles. Okay, good. All right, good. So that's the range of motion for the wrists. Now I'm going to examine the elbow. I'm going to do the right one first. I'm looking at the same thing. I'm just looking, inspecting for nodules, any abnormalities of the joint, any redness if the joints are inflamed or tender by just looking. Okay, so I'm going to look at the other one as well. Okay, so there doesn't seem to be any abnormalities in the inspection. Now I'm going to palpate both elbows. Now there's some areas, landmarks that I'd like to mention. This bone right here that sticks out is the lateral epicondyle. This is the olecranon process, this bony part. And the medial side, which I'll use the other elbow to show, bend your arm, is right here. This is the medial epicondyle. So these are the joints, these are the landmarks that I'm specifically checking for inflammation. Okay, so if the patient has a lateral epicondyle tenderness and inflammation, it can be called tennis elbow because of the backhand movement. It can get irritated. If the medial condyle is irritated or inflamed, it could be called golfer's or baseball's elbow because that could be tender doing the swing of hitting a baseball or a golf ball. Okay, now we're going to check for range of motion of the elbows. I'm going to have the patient hold out her arm like this, palms up. All I'm going to ask you to do is put your hands to your shoulders so you're bending your elbows. That's flexion of the elbows. Now extend your elbows by going back out. Okay, now I'm going to ask the patient to pronate, which means to go downward with your hands. That's pronation. And, that is supination. No, that's pronation. Now supination is coming out this way. That's supination of the elbows. Okay? All right, now we're going to move up to the shoulders. You have to turn yet. Okay, so I'm looking at the shoulders. Are they the same height? I'm looking at the joint for swelling, tenderness, as far as the way it looks. Is there anything that's abnormal about her shoulders? Okay? Now I'm going to also palpate them. There's some landmarks that I'm going to go over. The patient could just slightly turn this way. Okay, the bony part sticking up here is the acromion. Okay, let me find it first. Okay, I believe it's right here, and then there's the joint of it where the clavicle and the acromion come together. It's about right here. This is the greater tubercle of the humerus on the lateral side, the deltoid side of the shoulder, and in the front here, you have coming up this way where the bicep muscle comes in. On the humerus, there's a groove called the bicep groove where the muscle comes in to connect to the shoulder. And then we have the, right below the clavicle, there's the coracoid, I think it's called the coracoid process. So these are some of the landmarks of the shoulder. Okay, so I'm going to palpate those on both sides for any tenderness or pain. Okay, all right, now we're going to do some range of motion. Would be better done if the patient was standing, so I'm going to have her stand and then I'll adjust the camera. If you could face this way. Okay, I'm going to adjust the camera just a bit. Okay, all right, so I'm going to ask you to extend your shoulders by raising your hands over your head. Okay, and then you're going to come back down, that's extension, and then you're, that is flexion. Wait, hold on, I'm getting mixed up. I can do this. Okay, so see, that would be extension and flexion. Okay, so up is extension, extending up over the head, and then a flexion would be coming down behind her back. So yeah, that would be extension. All right, so then we're going to do abduction away from the body. So I'm going to have the patient bend the elbows and then just bring them to the side. This is abduction. So we're abducting the shoulder from down and then to up on both sides. Okay, now we're going to put this arm down and we're going to do the adduction where we take the arm and cross it over the chest there. And I'll do that with the other one. So this is adduction to the midline. Try not to turn the shoulders much. It's just right here in the joint. Good. All right, now while we're here, we're going to do the crossover test. So I'm just we're checking for impingement of this joint here. I'm going to have the patient cross over here, and I'm just going to push and tell me if there's any pain or tenderness in the shoulder.
No pain or tenderness.
Okay, and I'm doing the same thing for this side. Crossover test. Okay, so that's all the range of motion for the shoulders. Now we're going to do check the head and the neck. So the patient can go ahead and sit down for this. And then I'll see if I need to adjust the camera. Okay, so for the head and neck, I'm just going to look for symmetry again, inspection, like the cervical spine. I'm looking at that. Is it got the right curvature? Looking at the posture as well. Okay, now I'm going to palpate the cervical spine from C1 down to C7. Is it tender or painful?
No.
Okay, and now I'm going to palpate the sternoclavicle joint, which is in the front where the sternum and the clavicles meet on both sides. I'm going to palpate that for pain. No?
No pain.
Okay, now I'm going to palpate the TMJ joint, the temporomandibular joint, if you could open and close your mouth. No popping, clicking, or crepitus noted with the palpation. Did you feel any tenderness or pain?
No.
Okay. All right, so now I'm going to check the range of motion of the neck. So I'm going to ask the patient to just turn her head from one side to the other. Okay, now bring your chin to your chest. This is a forward flexion, and then go ahead and extend your neck back. That's extension of the neck. Okay, bring it back. And then I'm going to do lateral, also from one side to the other. So take your right ear and then bring it down, or your left, whichever one you want to do, but just go down to each side. Okay, good. Okay, so that's the range of motion for the neck. Okay, so now we're going to start with the feet and go upward to the hips. So I'm going to ask the patient to step around and go ahead and lay down in the bed, and then I'll adjust the camera. Okay, we'll adjust it if we need to, but I am going to start with the feet. Okay, so first I'm going to inspect the toes, the joints. We've got the distal and the proximal interphalangeal joints, and then we've got the metatarsal joints on both feet. I'm looking at these joints specifically. Are they symmetrical? Do any of the joints deviate laterally? Is there any redness or swelling or deformities of any kind? I'm also looking for bunions, corns. Flat-footedness can be checked if she's standing flat, if she stands up, and if the arch is touching the floor, then that would be flat-footedness. I verbalized that, we're not gonna actually demonstrate that. Okay, so far I'm just inspecting, okay? So now I'm gonna go ahead and check all the joints that I just mentioned for tenderness. And the patient will let me know if she feels any pain. Or is it just plain tenderness? Okay, inspected, palpated. Now I'm going to check some range of motion. If you could kind of curl your toes, good. And now extend your toes up that way. Okay, good. All right, so that's the range of motion for the toes. Now I'm going to look at the ankles. Same thing, I'm looking at the joints. Are they swollen? Is there any type of deformities? Any redness? I'm going to highlight some of the landmarks. This part of the ankle bone right here is called the lateral malleolus. And on this foot I can show you this is the medial malleolus. Okay, so those are the joints that I can palpate and see if there's any tenderness. I'm also going to palpate the Achilles here and the gastrocnemius muscle in the back. Is there any pain or tenderness here?
No.
Okay, I'm going to do the other leg. Okay, now I'm going to check for range of motion of the ankle. I'm going to ask the patient to dorsiflex by bringing her toes towards her knees. That's dorsiflexion. And now I'm going to ask the patient to plantar flex by pointing the toes. Now we're going to do the same thing with resistance. Please press against my hands and press this way down. Okay, I'm going to go ahead and do that with the toes. I kind of forgot to do that. So with just your toes, go forward and then go downward. Okay, good. All right, now I want you to, with your ankles, rotate in circular motions, one way and then the other. Okay, all right, now we're ready for the knees. All right, so I'm looking at the knees. Are they equal, the same, symmetrical? I'm also looking for valgus and varus positioning. If the knees were knock knee, they'd be valgus, which is bringing toward the midline. If they were varus in position, the knees would be outward, kind of like bow-leggedness, and I don't see that here. I did not note that when the patient was standing as well. Okay, so now I'm going to palpate for tenderness of both of the knees. I've already inspected them. Now I'm going to palpate them. I'm going to ask the patient to bend the knee slightly. I'm going to palpate about 10 centimeters above the patella. I'm looking for the suprapatellar notch and then the patella itself. And then I'm going to be palpating in the back of the knee at the popliteal fossa. It's like a little cavity there. If there's any nodules or masses, it could be a Baker's cyst. So I'm going to start with a palpation above. Subpatellar notch here. And now the sides of the patella. And then the back of the knee. No masses noted. Okay, now the next leg. Bend your knee slightly. Again, the same thing. Okay, all right, so that's the palpation of the knee. Now we're going to conduct 5 tests on the knee joint. The first 2 tests that I'm going to do are called valgus and varus stress tests. The valgus test is to test for the, both tests actually test for the medial and lateral collateral ligaments. Okay, so I'm going to do one leg at a time, but both tests on each leg, and I'll talk through it. So I'm going to start with her left leg. I'm going to have the patient bend her knee. I'm holding her leg like this. Okay, so the First test I'm going to do is the valgus stress test. I'm going to hold the knee and the heel, and I'm going to abduct the heel away from the body, and this is testing the medial collateral ligament. Okay, coming back to center. Now I'm going to bring the heel medially to the body. This is the varus test, and I'm checking. I'm stressing the lateral collateral ligament. Any pain or tenderness with each of those?
No.
Okay, so I'm going to do the same thing on the other leg. Okay, so that's the varus and valgus stress test, testing the medial and lateral cruciate ligaments. Now we're going to test, I'm going to do some tests to test for the anterior and posterior cruciate ligaments. I'm going to conduct two tests. The first one's called the drawer test. The second one's called the Latchman's test. So I'm going to start with the drawer test. About 30-degree angle. I'm going to actually sit on the patient's foot to stabilize the test. Okay. All right, so I'm going to bring kind of a sudden jerk motion forward, anterior and posterior, to check for these anterior and posterior cruciate ligaments. I'm checking for the laxity of the ligaments. If they're really loose, the knee would be very mobile. Okay, I'm going to do the best I can on this chest here, since we don't have an examination bed. Okay, so here we go. Okay, there's no laxity of those cruciate ligaments. Okay, now this test is called the Latchman's test, and it's very similar to the one that I just did. This one is 20 to 30 degrees. I'm again testing for the same ligaments. I'm going to stabilize the femur like this, and I'm going to basically try to bring the tibia toward me, and if the ACLS, the anterior cruciate ligament, is torn, then this knee would easily come forward, but if not, I will feel an end point. 1, 2, 3. Definitely an end point. Same thing for the right knee. Stabilize it here. 1, 2, 3. End point. So she's negative for those two tests. Well, the same test on both knees. Okay. Now I'm going to check for the meniscus, the anterior and posterior meniscus. Okay. And this is called the McMurray's test. So for this test, I'm going to again raise the leg up here like this. Okay, and then I'm going to turn the ankle or the heel laterally, and this is going to test the anterior meniscal, the anterior meniscus, and I'm going to go forward and back, nice and slow. And if she has a tear, this would be very hard to do. It would be very painful. Okay, now I'm going to turn. Internally rotate or medially rotate the ankle and do the same thing to test for the lateral. Okay, now with the next leg. Rotate outward and back and medial. Okay, that's the McMurray's test. Okay, so now I'm gonna move on to the hips. If the patient had less clothing and we had an examination bed, I would want to walk around to the other side to make sure I'm examining both sides of her hips. This is a king size bed. I'd be out of the frame if I did the other side. So I'm looking for are the landmarks of the hips, are they the same? Which if they weren't, maybe one leg would be longer than the other. I'm looking for the anterior supra iliac crest, and it's right here. Here, and then the greater trochanter is on the side here of the hips. It's below the iliac crest, so I got my landmarks, and they're the same. If I could visualize it, if she didn't have shorts on, I could inspect it So I inspected for symmetry, any abnormalities. I'm still looking at the joints of the hips like I've looked at all the other joints, nodules, inflammation, any abnormalities. And then palpating is also for the same thing, and to find the landmarks, to make sure that you know where the landmarks are. Okay, now that I've done that on the anterior side, I'm also going to inspect the posterior side. So go ahead and turn on your stomach, and then I'll look at the landmarks of the hips and the back. Okay, so this again, I'm going to have to talk through it. The two landmarks I want to talk about are in the sacrum area. Okay, so we're still talking about the iliac crest. On the medial side, toward the body of the iliac crest, is the posterior suprailiac crest. So it'd be on the lateral sides of the sacrum, and then where that bone connects with the sacrum is called the sacroiliac joint. I'm also going to palpate that for tenderness. And is it symmetrical? Okay, good. All right. So now that I've done that, I've inspected both sides of her hips from both sides of the examination table. I've palpated the landmarks, and I've palpated for tenderness and pain. I'm now going to start the range of motion of the hips. Now, that because she's in this position, I'm going to start with hip extension first. I'm going to do passive, and then she'll do active. Okay, so I'm doing extension of the hips. This is the passive, so I'm going to put my hand under here and gently raise up. That's extension. Other leg. Extension. Okay, now I'll ask the patient to do the same thing on her own. Good, so she's got good extension of the hips. Now we're going to check the flexion of the hips and other areas, rotation of the hips. So I'm going to ask the patient to go ahead and go back on her back. Okay, so before I check the flexion, I'm going to check the rotation of the hips. So I'm going to ask the patient to bring the leg up like this. And I'm just going to gently rotate the hip. By moving the ankle medially, laterally, it rotates the hip joint. Good on that side. And then after I do it passively, I'll ask the patient to do it herself, which is active. Okay, go ahead and try that. Good. Okay, the other leg there. Okay, then bring yourself back to the starting position. Now we're going to do the flexion of the hip. I'm going to do it first myself, the passive. Okay, watch your hands. I'm going to bring it towards your chest, your knee toward your chest, and then back. That's flexion, passive motion. Okay, now I'll ask the patient to do it herself. You can use your hands. Okay, now we're going to do the abduction and adduction of the hips. I'll do it first, so this will be passive. We're going to abduct, so away from the body. Just relax your hips, and I'll guide you. Okay, now I'm going to do the adduction, and I'll have the patient do it herself. So for the adduction, passive, you cross over, and then we'll do the same here. Adduction, cross over. Okay, now I'll ask the patient to go ahead and do lateral away from your body. Good. Good. And then bring it from out all the way in and cross over. Cross over. Good. Good. One more time for this side. Okay, good. So that's abduction and adduction of the hips. Okay, so now we're going to do, trying to think what the hip test was, because those were just range of motion. Oh, the hip test, the Thomas test. Okay, the Thomas test is to check for hip flexion contractures here. So this leg's going to be straight, and then I'm going to ask the patient to pull her knee all the way to her chest as much as she can. And if this leg, if this hip had a contracture, then the knee would kind of be up, and this would be called a hip flexion contracture, but she does not have that problem. Now we'll go to the next leg. Okay, this leg also stayed down, so she doesn't have any contractures in her hips. Okay, the next one is called, right now I can't think of the name, but I know how to conduct it. So this test is also to check, we're checking for impingement. The other one was contracture. This is for impingement of the hip joint. I'm going to have the patient bend the knee, and then she's going to cross it over here like this. I think this is called the Patrick Faber test. Faber stands for flexion, abduction, external rotation. Thank you. All right, so I'm going to stabilize her iliac crest here, and then I'm going to push down on the knee and just try to relax your muscles as best you can. If she has any impingement or pain, it could be radicular problems in that area. So now we're going to do the other leg. Okay, stabilize the iliac crest, press down. No pain? Okay, so that concludes the hip part. Now we're going to move from the hip to the spine. I'm thinking we're almost done. Okay, so just because of the fact that you're already laying down, and I believe that the rest of the test is standing up, I'm going to conduct the straight leg test. This is to check to see if she has any impingement or any like herniated discs in the spine. I'm going to have her keep her legs straight, and if you feel like you're going to bend it, stop, but you're going to raise your leg. It's called the straight leg test. Good, good, good. That's great. No pain, I guess.
No pain.
Okay, do the other leg. Straight leg test. And this is for the spine. There's any issues there with the herniated discs or things like that. Okay, so now the rest of the test can be standing up. I'm going to have you have your spine, your back toward me. Okay, so the first thing I'm going to do is inspect the spine. I'm looking again for symmetry. I'm looking at the landmarks of the shoulders and the hips. Are they the same height? Is her spine straight? This is just inspection. Everything looks good. And I'm also going to look at the curvatures. Her cervical spine and her lumbar spine should have a lordosis type of curvature inward, and the thoracic spine should have a kyphosis curvature outward. So it goes in here, out, and then in. Those are the things that I'm looking for. Okay, now I'm going to palpate for tenderness. I've already palpated the cervical spine. Now I'm going to go through the thoracic spine down to the lumbar, all the way down to the coccyx spine, past the sacrum into the coccyx. Any tenderness?
No.
Okay, now I'm going to percuss also for tenderness. The scapula area as well as down the spine. Okay, so no tenderness noted. Okay, so we palpated for pain and tenderness. I looked for and inspected for any abnormalities. So now I'm going to check several things. I'm going to ask the patient to bend forward slowly, and this is what I'm checking for. I'm checking to see if when she moves forward, bends forward, are her shoulders and hips going down symmetrically? In other words, is the movement symmetrical, or is she kind of wobbling from side to side as she's going down? I'm going to look at the spine to see if there's any lateral deviations with movement. She doesn't have any standing straight. I didn't notice anything with palpations, but it might be noted when she bends forward. So also when she bends forward to touch her toes, I'm looking for forward flexion of the spine. So I'm looking at all these things while she goes forward. So go ahead and go at your own pace. Okay, and hold it when you get to the bottom. I'm looking at the spine. It's straight, no lateral deviations. Her shoulder blades are the same. Her hips are the same. Everything is the same. Okay, and good forward. She's got good range of motion. Now I want you to come back to the starting point. And then flex, extend your head back so you can extend So this is extension of the spine. That is good. That's good amount. Okay, good. Okay, so now we're going to check the range of motion of the spine. I'm going to have the patient face the camera, and I'm going to step over here to demonstrate so she can watch me. I want you to start with the lateral, going from one side to the other. This is the lateral of the range of motion of the spine. Now I'm going to ask you to, now we've already done the forward flexion and the back extension of the spine, so the only thing left is to keep your hips straight, and you're going to rotate. This is a rotation of the spine. Just have your shoulders rotate from one side to the other. Right. Okay, so that is the end of the spine, but except for the test. Remember the last test that I'm not going to do. So that's the end of the spine exam. And if I were to do this test, which I'm going to verbalize, I don't want to do it. So anyway, it's called the Sperling's test, and it checks to see if there's any tenderness in the discs of the spine, especially in the cervical area, cervical radiculopathy. So I'm going to kind of somewhat demonstrate it. The patient would extend her neck back slightly and turn to the side that you want to check first, and the examiner would put pressure on the top of the head downward, and if it causes any pain, then the test would be positive. To do the other side, the patient would extend the head back and then look this way slightly, and again put pressure on the head downward to check for any pain or tenderness. And that concludes the test. Thank you so much.
And I'm very proud of her.
Thank you.